This annual general meeting is taking place after a gap of 4 years. Due to ongoing pandemic, we have this virtual meeting, but I am sure we can make it memorable for all times to come. The year 2020 is a special year for Indian Red Cross as we complete 100 years of our founding. All of us are fortunate to be a part of this historic AGM during the centenary year. Today, I am proud to say that Indian Red Cross and St. John Ambulance have lived up to their commitment and contributed for the betterment of the society. Let me use this opportunity to share some of the recent achievements of both the organizations. While the Government of India is leading from the front in responding to COVID pandemic, the supportive role played by both the organizations have been of immense value. Thousands of our volunteers across the length and breadth of the country are relentlessly working in the communities for the sake of helping others. The ongoing activities already undertaken include advocacy and awareness campaign, community surveillance, procurement and distribution of items like PPEs, masks, sanitizers, gloves, distribution of food items, transportation of patients, logistic support to isolation and quarantine centers, ensuring availability of blood and blood services, and coordinating on behalf of Government of India import of essential items like PPEs, test kits, ventilators, oxygen concentration. We are thankful to our Honorable Chairman for having faith and entrusting us with this responsibility. Our network of 89 Red Cross blood centers rose to the occasion to ensure availability of blood and blood components in the country. We came up with innovative ideas to motivate people to donate blood while ensuring safety and hygiene practices. I take this opportunity to specially thank and laud the generosity of all blood donors. We have also launched a blood service mobile app, which is helping people book blood through their mobiles. We've also set up 24/7 control room. Recently, Indian Red Cross headquarters has started a thalassemia screening and counseling center, which shall help us reduce incidences of thalassemia in the country. Disaster response has been the core activity of Indian Red Cross. This year, we pre-positioned around 50,000 tarpaulins and other relief materials. These came handy during Cyclone Amphan and unprecedented floods in many states, including Assam, Bihar, and Uttar Pradesh. This helped in prompt distribution of items to affected families, which has been appreciated by local government. We've now decided to pre-position relief materials not only in the 6 regional warehouses of national headquarters, which we've been doing so far, but also in the warehouses of disaster-prone states. We made specific efforts for branding of relief material to improve visibility and recognition of Indian Red Cross. Special precautions have been taken to ensure uniformity in the logo of Indian Red Cross relief material and jackets to be used by Red Crossers. You must have noticed the improved branding of Indian Red Cross on the masks and soaps being distributed across the country.
सर ये पीछे से कनेक्ट कर रहे हैं ना सर, वो अनम्यूट कर रहे हैं, तो उन्हें म्यूट कर रहे हैं सर कंटिन्यूअसली। ये बहुत में होते हैं।
We request all the participants to kindly unmute themselves and kindly allow the proceedings to carry further. Thank you. We are of the view that Indian Red Cross and national headquarters cannot be strengthened without strengthening the state and district branches. Therefore, to make state branches sustainable and vibrant, a number of decisions have been taken. National headquarters will give 80% of the cost of any new initiative to be taken by a state branch which has a visible impact on the ground. In order to extend helping hand to smaller and financially weaker branches, particularly in Northeast, National Headquarters has come out with a scheme under which National Headquarters will deposit rupees 1 crore each in the fixed deposit, interest of which will accrue to the respective branches. We've already deposited 1 crore each, interest of which is going to Tripura and Andaman Nicobar Island branches. We've started using technology, not just for communication, but also for mapping of communities at risk. A project with the support of Google to provide early warning to the people in remote areas is being started in Assam and Bihar. Based on the experience of this project, we will plan more such projects in other parts of the country. Learning from the current pandemic, We've started using technology for improved office functioning. The video conferencing facility has been upgraded. Periodic publication of e-newsletter will help not just the wider circulation but also contribute in saving paper and hence the environment. Our website has been revamped and has now become more user-friendly. Our social media activity and outreach are now at the record high. Transparency and streamlining is another priority areas. Some of the steps taken to ensure transparency include posting of our monthly expenditure on the website, requirement through government e-portal, and implementation of file tracking system in the national headquarters. Recognizing our responsibility towards environment, we've installed rainwater harvesting system at the national headquarters premises. Installation of solar energy plant is in process. Upon completion, this will produce thousands of units electricity every year. I would like to convey my sincere thanks to all our state, union territory and district branches, their leadership, volunteers and staff, as without their support and ground level work, we would not have become the leading humanitarian organization in the country. St. John Ambulance is also playing a key role in the overall humanitarian services, especially during emergencies like the ongoing COVID pandemic. They have helped people in need through their ambulance, first aid and allied subject training. I must recognize today the key factor behind our achievements. This year and for last 100 years, the backbone Indian Red Cross is volunteers who selflessly give their time, energy and efforts to serve the people and help Indian Red Cross achieve the objectives. I take this opportunity to thank all the volunteers for their commitment to humanitarian work.
My name is Amar.
While we will continue with ongoing initiatives, the focus in times to come will be on enhancing and improving blood services, increased humanitarian response, making branches self-sustainable, and increasing our footprints at the national level. With these words, I once again welcome all of you and express our commitment to do more, do better, and reach further under the visionary guidance and leadership of our Honorable Chairman. Sir, thank you very much. Before I start the statutory agenda item, if you permit me, sir, our Vice Chairman has penned down a book on his experiences for the Red Cross for the last 3 years. So we would like you to इस किताब की आप विमोचन करें जी सकते हैं I'll request the Shri Avinash Khanna, Vice Chairman, Indian Red Cross, to share his experiences very, very briefly. Please.
Honorable Chairman Sahab, all Honorable Governors, Lieutenant Governors, IRCS के मैनेजिंग कमेटी के मेंबर, जॉन एम्बुलेंस के मेंबर साहबान, इंटरनेशनल डेलीगेट्स, इस बुक में मैंने कोशिश की है कि जो 4 साल में मैंने जो इनिशिएटिव लिए उनको डॉक्यूमेंटेशन किया जाए ताकि ये सब सर्कुलेशन में जाएंगे तो छोटे छोटे काम रेड क्रॉस का इमेज, रेड क्रॉस की मूवमेंट कैसे बढ़ा सकते हैं उसका जिक्र इसमें किया गया है। मैं ज़्यादा समय नहीं लूँगा, एक बात कहूँगा कि एक अच्छा लीडर मिलने के बाद और एक डेडिकेटेड टीम मिलने के बाद रेड क्रॉस के काम को काफ़ी गति मिली है। आपका इंटरेस्ट, सारी टीम का इंटरेस्ट जो है वो रेड क्रॉस की एक्टिविटीज को काफी तेजी से आगे लेके जा रहा है। इसके कारण ही हम लोग पंजाब में 3 यूनिवर्सिटीज के साथ एमओयू साइन कर पाए हैं, जहां पर रेड क्रॉस और डिजास्टर मैनेजमेंट एक सब्जेक्ट पढ़ाया जाता है। और एक यूनिवर्सिटी में अभी गया था तो 3000 बच्चों को फर्स्ट एड ट्रेनिंग देके उन्होंने एक्टिवेट किया है। तो मैं ऑनरेबल गवर्नर साहब से निवेदन करूंगा, जितने गवर्नर साहब सुन रहे हैं, वो बहुत सी यूनिवर्सिटीज के चांसलर होते हैं, अगर वो अपना गुड ऑफिस यूज करके इन यूनिवर्सिटीज के साथ एमओयू साइन करके फर्स्ट एड और डिजास्टर मैनेजमेंट एक ऐसा सब्जेक्ट वो पढ़ाएं तो वो एक अच्छा मैसेज जो है वो स्टेट में जाएगा और ब्रांच भी एक्टिवेट होगी। सर, जहां तक के पंजाब की वार एसोसिएशन पंजाब एंड हरियाणा, उन्होंने भी रेड क्रॉस की ट्रेनिंग लेने के लिए जो है वो अपने 100 से ऊपर मेंबर जो है आए हैं और 2 हाई कोर्ट के जज उस कार्यक्रम में आए। तो मैं ज्यादा समय न लेता हुआ मैं सिर्फ एक ही रिक्वेस्ट करूंगा कि रेड क्रॉस को हमें गांव तक कैसे पहुंचाना है और एक स्टेट में एक मॉडल डिस्ट्रिक्ट कैसे बनाना है, हम सब मिलके उसके लिए काम करेंगे। आपका बहुत बहुत धन्यवाद।
Thank you very much. I will now start with the statutory agenda items of the AGM. The first agenda item is the confirmation of the proceedings of the annual general meeting of Indian Red Cross held on 30th August 2016. यहाँ के सिस्टम में हो रहा है, उधर से नहीं हो रहा है।
नहीं सर, एक्चुअली तो यहाँ से सबको म्यूट कर दो। आप यहाँ से सबको म्यूट कर दो। सर, सबको म्यूट करना, कंटिन्यूसली कनेक्ट हो रहे हैं सर, कंटिन्यूसली।
आगे कनेक्शन मत कर दो, जो आ चुके होंगे क्या डाल दीजिए।
नहीं, ये तो मत करिए।
Sir, the first is confirmation of the proceedings of the last meeting held in 2016. We have circulated the proceedings and no comments have been received. And if you agree, we will confirm the proceedings which was held more than 4 years ago. The second agenda item is, sir, the adoption of the annual reports of Indian Red Cross for the year 2016, 17, 17, 18 and 18, 19. These annual reports were placed before the national managing body, and national managing body has approved it, where all the members of the managing body were present. So if the AGM agrees, we can adopt this. We circulated, we sent it to them, we put it on the website also, sir. So if there are no comments, we can, for the annual reports, we can adopt these. Maybe, sir, if you want, I can highlight some of the, I can point out some of the highlights.
It has been circulated.
It's been circulated, sir.
But and if there are no comments, you can.
All right. Since there are no comments, it's been circulated, put on the website also. If there are no comments, we can adopt the annual reports of Indian Red Cross for the years 2016, 17, 17, 18 and 18, 19. Okay. Sir, the next is the adoption of the audited annual accounts of Indian Red Cross for the year 2016, 17, 17, 18 and 18, 19. Like annual reports or audited annual accounts have also been approved by the National Managing Body of Indian Red Cross. These have also been circulated, put it up on the website. No, and unless there are some comments, we can also adopt these annual reports of these 3 years. Next is the annual budget estimate of the income and expenditure of IRCS for the year in Indian Red Cross for the year 2020-21. This annual budget estimate has also been approved by the National Managing Body, and this has also been circulated, put it up on the website. So if there are no comments, then the annual general meeting can adopt the estimated the annual budget of IRCS for 2020-21. So the next is appointment of statutory auditors for the year 2019-20. As per the recommendations of the Finance Committee of Indian Red Cross, the recommendation is that the existing chartered accountant, which is Messrs. KG Somani and Company Chartered Accountant, for disaster relief fund, including warehouses, and the amount is 24,000 rupees. For rest of the accounts other than disaster relief fund, Messrs. Shri Ravi Verma and Company Chartered Accountants for 60,000 rupees. They are the existing chartered accountants, so their appointment may be approved. And for the next year, 2020 and later, the process will be, the matter is being processed by the Finance Committee. Similarly, sir, for St. John Ambulance India, the first agenda item is confirmation of the proceedings, which were the joint proceedings of Indian Red Cross and St. John. The meeting was common again last time in 2016. The proceedings have been circulated jointly, put it up on the website, and no comments have been received. So we can we can confirm the proceedings of the last AGM held on 30th August 2016. Sir, annual reports of St. John Ambulance India for the year 2016, 17, 17, 18 and 18, 19 have been approved by the National Council in the meeting held under your chairmanship on 28th July. The previous National Council meeting was held almost 4 years ago. So these 3 years annual reports have been again circulated, put it up on the website. So if the AGM agrees, we can adopt this. Next is, sir, the audited annual accounts of the St. John Ambulance India for the years 2016, 17, 17, 18 and 18, 19. These audited annual accounts have also been put up on the website, circulated, approved by the National Council. So we can also adopt these annual audited accounts if the AGM agrees. So the next is the annual budget estimate and income and expenditure of St. John Ambulance for 2020-21. These have been approved by the National Council and put it up on the website, circulated to the member. We can also approve the annual budget estimates of income and expenditure. About the statutory auditors for St. John, so the National Council agreed that the statutory auditor of Indian Red Cross should also be the statutory auditor of St. John. Therefore, sir, the appointment of Shri Ravi Verma and Company Chartered Accountant for 2019-20 may be approved, and the remuneration given to them is rupees 54,000. So if that is also approved, sir, the statutory agenda items are complete. Now, sir, with your approval, we can open the house, and since we have few governors who are present here, so maybe we can, the honorable governors, whoever wants to say something, participate or give their suggestions, we can give them an opportunity with the approval of honorable sir.
I think we can one by one you can request each one of them, and if they want to make some comments or observations or any guidance or advice, they are welcome. You can name one by one. That will be a better way.
So as per the information received by us in the national headquarters, we've got that the Honorable Governor of Maharashtra, Shri Bhagat Singh Koshari ji, will be present for some time in the beginning. So if the Honorable Governor is present himself, he may like to share his views or give some comments or suggestions. So I will request my colleagues to kindly identify and unmute Maharashtra if the Honorable Governor is there. Otherwise,
भगत सिंह कोश्यारी जी, ऑनरेबल गवर्नर, आप हमें पता लगा है कि आप उपस्थित हैं. You can please offer your few words of wisdom.
maybe sir, he will be leaving. He may have left because he had another engagement. So we've also received a message that Madam Anusuya UK from Chhattisgarh, Honorable Governor Chhattisgarh, she would be present. So we would request Madam to say few words. Honorable Governor from Chhattisgarh. Honorable Governor from Chhattisgarh.
Yeah, you can talk.
we'll wait for some time. In the meantime, we have a message that Honorable Governor from Himachal Pradesh, Shri Bandaru Dattatreya ji उपस्थित हैं. Honorable Governor from Himachal Pradesh.
English speaking.
Honorable Governor from Himachal Pradesh. I also have information that we have honorable governors who are likely to participate from Jharkhand, Manipur, Nagaland, Uttar Pradesh, and Uttarakhand. So since there is some technical glitch in trying to put this, so whichever. Himachal Pradesh. We Honorable Governor Himachal Pradesh is on the screen, so we will request others to kindly. Honorable Governor Himachal Pradesh, yes. Others may kindly mute. Honorable Governor Himachal Pradesh is on the screen. Others may kindly mute their speakers. Yes, Honorable Governor Himachal Pradesh, you can kindly give your word.
I welcome the Honorable Minister Sri Ashwataji and all other scholars, delegates. I am very happy to support the meeting. Our Red Cross Society, Indian Red Cross Society, which another meeting is going on, in which mostly the confirmation of proceedings of AGM and other annual reports and approval of the budget. But as far as Himachal Pradesh is concerned, whatever the help has come from our society, our number of various representations we have provided, and all the masks distributed by the state Red Cross, 28,170, and all district Red Cross branches, masks distributed.
As per usual, we have the honour of Dr. Tedros, WHO Director General, to provide his opening remarks. I'll give the floor immediately to DG Tedros, given the very full agenda we have today. So, DG, you have the floor.
Thank you, Tim. Honourable Ministers, Excellencies, esteemed colleagues, thank you for joining us for this week's Member State briefing. 2 weeks ago, I informed you about allegations of sexual exploitation and abuse during the Ebola response in the Democratic Republic of the Congo. Today, I'm announcing the establishment of an independent commission to investigate these allegations, identify systemic issues, and review existing prevention measures. The commission will be co-chaired by Her Excellency, former Foreign Minister Aishatu Mindadude, the former Foreign Minister and Social Development from Niger, who has led and held senior UN posts in Cote d'Ivoire and Darfur. She will be joined by co-chair Julien Lusenge of the Democratic Republic of the Congo, Madam Lusenge, an internationally recognized human rights activist and advocate for survivors of sexual violence in conflict. The role of the Independent Commission will be to swiftly establish the facts, identify and support survivors, ensure that any ongoing abuse has stopped, and hold perpetrators to account. We look forward to their recommendations. The co-chairs will choose the other members of the panel, which will be supported by a secretariat based at WHO comprised of staff of the organizations concerned. To support the Commission's work, I have decided to use an open process to hire an independent and external organization with experience in conducting similar inquiries. Meanwhile, WHO is already taking steps to ensure our existing prevention and protection mechanisms are fit for purpose and fully implemented in all of our emergency operations. I would like to reiterate the betrayal of people in the communities we serve is reprehensible. WHO has a very clear policy on sexual exploitation and abuse. Zero tolerance. Now to today's briefing. We will start with presentations on lessons learned in responding to the COVID-19 pandemic from 2 countries in the Africa region. We will first hear from His Excellency Dr. Ahmadu Lamin Samate, Minister of Health of the Gambia. We will then have a presentation from Dr. Anas Mahomba, the Chief COVID-19 Coordinator of the Office of the President and Cabinet from Zimbabwe. Following the 2 country presentations, we will receive an update from my colleague, Brett Archer, who will discuss trends in cases and mortality rates and identify areas of particular concern. He will also be introducing some powerful information products, the WHO COVID-19 dashboard and the new Explorer app. These tools have been developed to share and visualize the data and information that you, the member states, share with WHO on a daily basis. The dashboard has daily updates on cases, deaths, and transmission, with tools such as interactive maps, epidemic curves, and downloadable country-specific information. The Explorer contains tools to monitor key indicators in areas such as testing and response. Finally, we will have an update on the Access to COVID-19 Tools Accelerator. We have some special guests today, the co-chairs of the ACT Accelerator Facilitation Council. I would like to extend a very warm welcome to Mr. Jonan Rotengen, Chief Executive of the Research Council of Norway, and Dr. Lindwe Makubalo, the Health Attaché of the Permanent Mission of South Africa here in Geneva. Thank you all once again for your continued support and commitment. We look forward to your questions, and I thank you. Thank you, Tim. Back to you.
Thank you very much, DG Tedros. As Dr. Tedros mentioned, we have 2 countries from the African region presenting this morning. Firstly, it is my honor to introduce the Minister of Health from the Gambia, Minister Excellency Dr. Samate. Excellency, you have the floor.
Yeah, thank you very much, Mr. Chair, Dr. Armstrong, and thank you very much, DG. We sincerely apologize. We have been connection problems, but we gradually get in there. Thank you very much. We in the Gambia, one of the smallest countries on the African continent, if not the smallest. We want to present the country situation since the COVID-19 pandemic started. Of course, as any other country, we've had our challenges and our successes. So we thank you very much, and we want to thank the DG very much and the entire team for us to be able to present in this forum today. We have a slide presentation. We don't know if we can have our slides up. The technical people available?
Yes, Excellency. If we can have your slides. Thank you.
Thank you. Good. Just a second as we open it. Yeah. Good. Thank you very much. Well, as you can see on the map, the Gambia is a very small country on the African continent, the west side of the continent in West Africa. For those who probably do not know, so we are small, even though people call us a small country. The adjective we are not very happy with is when they call us a tiny West African country. But we are a small West African country that has the demographic pattern just as every other African country. Since the commencement of the COVID-19 pandemic, which has become a very, very difficult challenge for the entire world, the Gambia also started pretty early when the outbreak initially started in Wuhan, then spreading to Europe and America, and then finally coming down to Africa. As we speak, we have already conducted 19,355 tests. We have had 3,644 positive cases and 2,645 recoveries. As a country, we have had 118 deaths so far, which is a crude fatality rate of 3.5. At this juncture, it is important for us to emphasize our strategy when it comes to testing, of the dead bodies. Now, when we look at the statistics, that for Gambia, comparing to some other African countries, seems high with regards to our population of 2 million cases. But we had variant testing mechanism for the dead patients, for the dead bodies. We insisted during the peak of the incident that every dead body in this country gets tested for COVID-19. Now, that had caused even delays in burials. Patient bodies stayed in the mortuary for 2 to 3 days while we sorted out the test. That time, the results used to be delayed because of the sheer number and the capacity to test. So this certainly has an impact on the high number of cases we see. But we think it was good because it allowed us to do very good contact tracing for dead people who tested positive for COVID-19. If these bodies were not tested, probably that opportunity would have been lost to do the contact tracing for those people. So yes, our figures are high comparatively, but I think our testing strategy was very good based on the reasons I just mentioned. During the pandemic, since it started, the Gambia has had various interventions. We can see the graph on the screen now. Various interventions took place from the point of the government. But at this juncture, I'm happy to say that there has been very, very high political support from His Excellency, the President himself, who has been at the helm of affairs, and then setting up of a cabinet subcommittee that dealt with the COVID issues. And that committee sat many times a week to come out with guidelines. Now we also have our technical groups in the various areas, in the various thematic areas. And we also have had a group of advisors, many of them who are experienced, retired experienced epidemiologists, public health officials. These serve as the body of technical advisors to myself and my team. And before we took any of these decisions, really, we got input from them. Many of them had worked in international fora, international organizations, including the WHO. So we came up with quite a number of actions, and that included the closure of the airports very early on. As you can see on the diagram in front of you, the airport was closed even before we saw the very first case. Now, this announcement was made. The land borders were closed, and they are still closed now, even though we are thinking of reopening the land borders and the airport as well. Now, there was a state of public emergency declared earlier on. These were well before even the spike we saw in the number of cases. Of course, we believe that these delayed the peak, and it shifted the peak further down to enable us prepare better to deal with the pandemic. When we saw the peak, suddenly it was a difficult period, and then the capacity was tested to the brink. Testing capacity was a challenge at some point. Equally speaking, contact tracing became very difficult. And then at some point, unfortunately, quite a number of the health officials themselves got sick. So this is the problem with infectious diseases. As a team, the health experts try to deal with the problem. They themselves are at risk, which actually ends up affecting the response. And Gambia has faced similar challenges. At some point, I myself was in isolation, including other members of the team. Fortunately, my test came out to be negative. I thank the Almighty Allah. But these are the challenges we had seen over the period. The graph in front shows our daily new cases, which you can see the daily number of new cases, which is going down. It has been going down over the period, and you can see the figure today. And the test done really also is going down. Now, we have quite a number of challenges now when it comes to the number of tests we are able to do as a country. Our capacity to test has increased, but people are no longer coming out in mass to get tested because, of course, some complacency has started to set in, because the number of positive cases is going down and the number of mortalities is going down. And so to say, many people are now not as afraid as they were before. So we are emphasizing on the sensitization, on the risk communication and behavior change, because they need to know that the risk is still there. As a minister, I also give weekly ministerial statements to the nation to remind the people of the risk still and the resurgence we are seeing in the number of cases in some other countries. With the hope that this will help to remind people that COVID is still around and it is still a reality. We can also see this is an analysis of the number of deaths that's reported on a given day, and this peaked around the 14th and to the 17th of August. At that time, we had an average of 6.3 deaths per week. Now, average of fewer than 1 death per week since late August is what we are having now. So that means the number of deaths, is reduced drastically. Now we can see the sex of the COVID-19 mortalities in the Gambia. Out of the 118 people, 67 were female and 51 were male. Now we had 118 people deaths, as I mentioned earlier. Now, out of that 74, only 74 were deaths in existing cases, and the posthumous deaths were 44. So, if we were not testing dead bodies, we would have gotten only 74 deaths as a country instead of 118. But as I mentioned earlier, we are happy that we are able to test those 44 dead bodies, because that enabled us follow up their relatives and their close contacts. So that was a strategy we thought as a country that was very useful. Now, as a country, we think we have had quite a number of achievements in the sense that there was a very strong government leadership and commitment. The government had dedicated a lot of funds to the COVID-19 response, and the government had also put forward a lot of public health social measures on the onset. There had been a state of emergency that restricted activities, business activities. In fact, as we speak, businesses are only starting to open as we speak to you. The government had also put forward social measures to support the population by providing rice, by providing oil, cooking oil, by providing sugar for the vulnerable communities, and that had been up to 84% of the population had been covered. So that was a very good initiative on the part of the government and the leadership of this country. So there was a whole government approach. Now we have had a very strong partnership from our partners. The WHO has been very, very supportive. Our WHO representative has been very supportive, attending the daily meetings with our teams, and then with myself meeting very, very regularly with regards to what needs to be happening, with regards to supporting, and then the COVID response, with regards to capacity building, training of our frontline workers, training of the laboratory personnel, with regards to provision of PCR machines, testing tools, and also other technical technical expertise, including provision of technical people, technical officers from the WHO Africa region and other countries. And that partnership has been very, very good in regards to our response. And now coordinating the other UN bodies in the response, that was also done by our country representative. And we thank him very much and thank the Director General for having given us such an individual to help in our response. Now, initially, we have had very stringent facility-based quarantine and isolation in the Gambia, which we believe also help us reduce the cases and also help us delay the peak of the disease. It was very expensive in the sense that individuals were kept in hotels where they underwent quarantine, but we think it has been very, very good and very, very effective. The national capacity for testing has also increased. Initially, the National Public Health Laboratory could not do any testing, but with support from the Medical Research Council, laboratories in the Gambia, and the WHO and other partners, we started now testing at the National Public Health Laboratory. And now all other two sites have been accredited for testing now. Now, currently, as a country, we have 4 sites where we are able to do testing, and we are getting 3 other sites ready for testing. Because we want to expand the testing. Now, our focus is on testing, facility-based testing. Because in the communities, presumably, we get more people coming forward to get tested because they want to travel and so on. And of course, few people who are asymptomatic. But we want to focus now on the facility where people with COVID-like symptoms would present, and then we want sample collection to be taken, to be done in each of those facilities, so that this can be tested. That we believe will give us a better pattern, of the disease in the country, and we want to expand that throughout the length and breadth of the country. Now, there has been local production of PPEs, hand sanitizers, COVID-19 specimen collection goods have been produced locally with support of the WHO, and also fabrication of containers for the treatment with support and funding also from the WHO, and with the construction work being done by UNOS. Now, there has also been training of critical response staff in case management, surveillance, and we have also used quite a lot of the funds of COVID-19 provided by the Gambia government and provided by the World Bank as well to procure a whole lot of life-saving equipment for strengthening our health facilities, and also to deal with the COVID and the thereafter of COVID. Now, this equipment include ventilators, monitors, infusion pumps, ambulances, and so on and so forth. So, therefore, we thank our partners, the WHO country rep, and our regional director, Dr. Moeti. Dr. Moeti has shown personal interest in what is happening in country. She finds out what is happening, and for her leadership, we are very grateful, and we extend our sincere gratitude for her undivided attention when it came to healthcare issues of the entire continent, and the Gambia. We can attest to that, and we thank Dr. Moeti as well. Of course, we cannot go without mentioning our challenges. COVID-19 has been a big challenge, unprecedented for the entire world, and Gambia is not an exception to that. We've had our fair share of challenges. Now, currently, we've been having low self-reporting of people with COVID-19 symptoms for testing during the low transmission period. Of course, there is still the issue of stigma. Even though stigma is going down, when the officials, all of us came out to test for COVID-19, and that helped to bring down the stigma, but still it is present. Also, scaling up and maintaining contact tracing activities during the high transmission period was a challenge. As I mentioned earlier, that was the time that we were virtually overwhelmed, in the sense that we had not seen anything like this before. So really, we didn't know entirely how to prepare exactly for every aspect of it, even though we did our best. But this was also coupled with the fact that quite a number of the health officials who were themselves, who were supposed to take care of those activities, themselves got infected. Now, another challenge we've had as a country is dealing with the rumors, myths, and denial of COVID-19, particularly in the regions, because the concentration was in the urban areas. So the rural people called it urban disease. They said it was not a disease of the rural people, and that unfortunately did not help. Equally, the politicization of the COVID-19 pandemic, when we have some people in the various opposition groups thinking that it was government propaganda. And unfortunately, that also went down to the ordinary people, and that did not help. So counteracting that information, misinformation was a big problem. And even WhatsApp messages, so the social media also did not help at some point, because people were sending messages, voice messages, spreading misinformation, and that also affected our response. At some point, it was also difficult to have adequate community engagement and risk communication, because as we inform the communities of the risk and what they need to do, others on the other side were also giving misinformation, and that also compromised what we were able to do. Now, currently, we have a decreased turnout of the clients for routine essential health services. Now, especially at the peak, when people actually thought that when they got to the hospitals, they were going to contract COVID-19. That discouraged them from going to the hospital. But the other thing is that some people also thought that when they got to the hospital, they were going to be tested for COVID, and if found positive, it goes with the stigma. Now, this affected the essential services, and also the fact that the same hospital workers who were to deal with other services were the ones dealing with the COVID response. That also, did not help when it comes to the COVID-19 activity. Of course, we have had strategies with the help of the partners, including the WHO, to have continuity of services. In our own case, the WHO helped to engage part-time, workers who are with us, and they are helping in the continuity of services. Now, there is also what we refer to as pandemic fatigue, with low compliance of the public to prevent, the preventive measures. Now, what we see is that mask wearing is become a big challenge. People are just not wearing the mask, and we are emphasizing Of course, it is illegal not to wear the mask in the Gambia as we speak, but it is very difficult for us to implement it because people now probably are having what we refer to as pandemic fatigue. They want it to be over, or some even say it is over. And we say to them, this is the opportunity, this is the time that we should re-strategize and make sure that we don't have a second surge. Now, we also have had case management challenges with a weak health system, and so other countries in our region have also experienced that, with very few intensive care personnel. As a country, we have only 2 intensive care doctors who are even technical experts. They are not non-Gambians. They are here, and we have only 4 intensive care nurses. So this is a big challenge. Even if we have the equipment, the capacity to deal with critical care is a big challenge for us. Now, another challenge we've had is delay in the procurement of most of the essential items we needed because most of them were not available locally. And of course, we had known about the shortage internationally because of the pandemic. But the fact that in Gambia, most of these items have to be imported and they have to follow stringent procurement methods, it also caused delay for us, and that was also not very helpful to the response. We are happy that, of course, the procurement rules were obeyed to the best practices in the country, which is also very important in dealing with a pandemic because it's also, if not properly done, abuses could happen. As a country, we insisted that the right things are done in the procurement processes, and that also helped to enhance donor confidence and the confidence of the local people because the funds that are meant for COVID-19 support are actually directed to COVID-19 support. But so at this juncture, it is important for us to mention the issue of full procurement system because if we have stronger full procurement system, probably all this would have been averted. By the time we have a strong, robust international partner that is able to procure these items in large numbers for many of our countries, that will, remove the procurement bottlenecks, and probably it will also expedite the provision of these items to the needed people. The priorities we have now is to operationalize the regional treatment centers. We're currently constructing regional treatment centers, even though the number of cases has gone down, but we want to be prepared for this pandemic if there is a surge and for any other eventuality in the future. We want to set up 3 additional PCR sites to increase sample collection. We equally want to intensify the risk communication strategies to improve compliance through non-pharmaceutical methods. Equally speaking, we are intensifying surveillance at all levels by the development of a new surveillance strategy based on the best practices, but also based on our current experience, what we have learned so far. Now, we also emphasizing on the continuity of essential services. We are doing advocacy on TV and radio and making the people know that essential services are continuing and it is safe to go to our hospital to get the care they need. Initially, we've had a decrease in immunization and, infant welfare issues, but it is picking up by the day. Now, we also want to improve on sub-national coordination and decentralization of the response. So even rapid response and contact tracing are now being decentralized so that it is done at the regional level. Once again, I thank you sincerely for giving me the opportunity to present the Gambia Situation Report, and I thank you for your kind attention. Thank you very much.
Thank you very much, Minister Excellency from the Gambia
Minister of Health, for your presentation. It is now my honor to ask Dr. Mahova from Zimbabwe, the Chief Coordinator, National Response to COVID-19 Pandemic in the Office of the President and the Cabinet. Dr. Mahova, you have the floor.
Dr. Mahampa, I'm just wishing to confirm that you're still with us and in a position to provide your country's experience. Thank you. Over.
Unmute, yes. Just bear with me. Perfect. Thank you very much, and to truly appreciate you giving Zimbabwe an opportunity to give this very brief update in terms of the COVID-19 response in Zimbabwe, looking at some of the lessons that we have learned. Zimbabwe basically developed a COVID-19 national response, preparedness and response plan very early on in the epidemic in March 2020. And this included prevention, containment, and mitigation strategies. And it was structured around the 8 pillars consistent with WHO guidelines. We went on to have a cabinet interministerial task force with 8 subcommittees. I might point these 8 are very different from the 8 pillars. As the subcommittees themselves, I hope you can still hear me.
Yes, we can. Thank you.
Thank you. The subcommittees themselves developed intersectoral operational plans, and these were guided by 2 levels, central level and operational level, for creating enabling environment and for field activities respectively. The intersectoral operational plans were also guided by 2 focus areas. First, the direct COVID-19 areas covering COVID-19 specific activities, such as manning quarantine centers, and of course the indirect COVID-19 activities, covering activities in ameliorating the socio-economic impact of the COVID-19, such as grain distribution and cash transfer to the most vulnerable groups. And of course, at that very early on in our response, an expert advisory committee was established to provide evidence-based advice and guidance to the national response. Very critical, we felt.
Dr. Mahamva, could we ask that you just slow your presentation speed down slightly, such as that the interpreters can more readily interpret the presentation into the 6 official languages? Thank you very much. Over.
So should I continue and sort of start? Sir, sorry.
Please continue, but just at a slower pace, if I may.
Perfect.
Thank you.
Thank you very much. So what I've just said, that overview, whole of government approach, looking at first the national preparedness and response plan in place, interministerial task force, subcommittees, coming up with the interministerial, or rather the intersectoral operational plans, and then the experts advisory committee is really summarized in this next slide, where I'm showing you the Zimbabwe COVID-19 management coordination structure, with the interministerial task force at the very top, working with the working party of permanent secretaries right below it, the experts advisory committee on the right, its command center on the left, and the subcommittees that I mentioned right at the bottom there, with a bit of detail on some of the focus areas that those subcommittees were looking at. And this is where that whole of government approach is actually coming through. Each of those subcommittees representing various sectors and translated into the operational plans, the intersectoral operational plans that I've just mentioned. So the first case, confirmed COVID-19 case in Zimbabwe, was reported on the 20th of March 2020. This figure here on the Zimbabwe COVID-19 epidemic curve is showing the key events, timelines, and clearly demonstrating that Zimbabwe introduced the total lockdown at the very beginning of the epidemic on the 30th of March 2020. And during the following months, you notice that that lockdown continued to be extended, but with some modifications at the various levels. This was meant to give our response time to prepare, put in place everything that was required. As we did that, we noticed the cases started rising, increasing somewhere in July. In fact, there was a sharp increase there. Government did not hesitate, but immediately introduced a curfew and stay-home order for non-working public. This, we believe, actually contributed to the decline that we then saw coming on towards the end of July. And that decline has actually continued up to today. As we continue modifying our lockdown extensions and lifting up some of the restrictions, we are hesitating, but we know our epidemic seems to be coming under control. As recently as the 1st of October, we again did some modifications and began to reopen schools in a phased approach, as well as reopening our airports. This distribution of COVID-19 cases and deaths by province, looking at as of 9 October 2020, we noticed that the cumulative confirmed cases for us by that time was 7,994. The cumulative deaths, 229, giving us a case fatality of rate of 2.9. The thing that I want to highlight in this particular slide is the fact that top there, Bulawayo and Harare metropolitan provinces are the hardest hit. They are in fact our hotspots and are contributing to the largest numbers. If you're looking at Harare, the cumulative is 3,274 and Bulawayo metropolitan 1,496. This next slide is showing the distribution of COVID-19 cases by age group as of 9 October 2020. Here, the highlight that I want to bring to your attention is the fact that the age groups between 20 and 60 years are the ones that are hardest hit, where you have the largest number of the confirmed cases, specifically 31 to 40. That's where we have our largest number. So we have been implementing the response guided by a very clear, detailed operational plan, using a whole of government approach, ensuring that intersectoral approach is really respected. There are some capacities that we have built that we're very proud to share. Looking at laboratory case management and isolation facilities, 7 COVID-19 PCR confirmatory laboratories, including some private laboratories, were introduced nationwide. COVID-19 PCR confirmatory testing was further expanded to all the 52 district laboratories using gene expert machines. Case management and isolation facilities were initially designated at the 2 main national infectious disease hospitals in the 2 metropolitan areas that I mentioned as the hotspots. But additional case management and isolation facilities, including some private facilities, were also identified and introduced in each of all the 10 provinces and major urban areas. Still on capacities that we have managed to build, looking at in-country manufacturing, and this is in line with the government's primary responsibility over the health of its citizens and its strategy and thrust towards introducing sufficient or having sufficient import substitution. The national response built capacity for local production of COVID-19 commodities, and specifically here we're talking of local universities setting up units to produce PPE, hand sanitizers, and some testing consumables such as viral transport media and swabs. We also look at the local pharmaceutical companies that set up production with support from government of registered medicines such as paracetamol and some of those antibiotics that are required for supportive management of COVID-19 cases. And the small to medium scale enterprises, government also produced or rather provided support for them to produce reusable face masks and hand sanitizers for the public, for use by the public. So with all that done, with a whole lot more that we can't summarize here, we have learned a number of lessons. First of all, Zimbabwe managed to delay COVID-19 epidemic through the stringent health and social measures that were enacted very early on. We implemented these stringent health and social measures, the public health and social measures very early on in the epidemic, as you saw on our epi curve. Number of new COVID-19 infections is now decreasing, and it is really a sign of an epidemic that is coming under control. And we do think the implementation of those public health social measures contributed to this decrease. The need to follow science in addressing this epidemic, whilst recognizing that it is a human social behavioral driven disease, is the key. And this is one lesson we are very happy to have learned and appreciate. Finally, the whole of government and whole of society, including public and private approach that government decided to use at the very beginning, we actually have learned and appreciate that it has actually strengthened our national response. Quite clearly, a number of things that we're proud of that we have learned, but there are also a number of challenges that we are working on as we continue. The disruption of the global supply chain really that contributed to the shortages of PPE and testing consumables that we have really continued to battle from beginning up to now. A struggling economy which had begun to grow following a raft of interventions, comprehensive systems, system-wide reforms rather, that we had actually started introducing before COVID-19. But because we were still struggling, our economy was still struggling, it has contributed to key challenges that can be articulated for each and every one of the 8 pillars. But just to mention a few, limited human resource for the required rapid response teams, the testing capacity, we really would have loved to do much, much more, but we have been limited, not just by the commodities, but actually by also the human resource components. Managing our porous borders and limited quarantine facilities to contain the importation of cases has been a challenge. We're happy to say we have somehow managed still. Limited infrastructure while we expanded and added on facilities throughout the country, but the equipment has been a challenge with our struggling economy to try and replace all the equipment and buy new equipment. And of course, the negative impact of COVID-19 itself and the response measures that we strictly, stringently implemented has actually affected the delivery of other essential health services. The low risk perception at individual level has contributed to limited adherence to recommended preventative measures. And yes, like Gambia, fake news on COVID-19 has fueled, continues to fuel poor adherence to recommended preventative measures. And finally, as we acknowledge that our epidemic seems to be coming under control, the difficulty in balancing continued implementation of those public health and social measures, while at the same time trying to begin to carefully relax some of these restrictions, is what we are battling with as we speak. So without continuing details, I want to thank you so much for giving Zimbabwe this opportunity. I would like to also thank the partners, our WHO, who have really been excellent in providing us support in doing this work that we're doing in Zimbabwe. Thank you very much.
Thank you very much, Dr. Mahonda from Zimbabwe, for the presentation of your country's response to COVID-19. Before moving on to the next segment of today's session, I just would like to recognise that we also have the honour today of being joined by the Regional Director for the African region, Dr. Maweti. Dr. Maweti, thank you for joining us on this COVID presentation today. Now we'll move to the next presentation, which is on the COVID-19 epidemiological update and overview of the WHO Global COVID-19 Dashboard and Explorer app. And I'd like to hand the floor now to Mr. Brett Archer, who's an epidemiologist in the WHE program. Brett, you have the floor.
Thank you, Chair, and thank you, Dr. Tedros, for this opportunity. So I'd like to spend just a few brief moments going through the EPI, the current situation. I believe everyone is quite familiar, but just to highlight a few areas of concern at the moment, but also spend a bit more time highlighting some of the tools and resources we hope you find useful for monitoring and tracking this epidemic. So first of all, on the global situation, we continue to see a bit of an acceleration of the pandemic. This last week, we saw over 2.2 million new cases confirmed and over 39,000 deaths reported to WHO, with several countries reporting their highest incidence of infection to date. Now, this is concerning. There's really 10 countries that are listed there that contribute or account for more than 2/3 of the new cases and new deaths that are being reported globally. If we look at this map, it really highlights the regions and countries where are currently experiencing the highest incidence of infection at the moment. The previous table and this map really highlight that the highest rates are observed currently within the Central American and South American areas, European areas, as well as parts of the Eastern Mediterranean, experiencing the greatest intensity per capita within the past week. If we examine the epidemic curves, we can see these trends in a bit more detail. Apart from Southeast Asia, all other areas are currently experiencing an increase or similar rates of infection and similar rates of cases and deaths to the previous weeks. Most concerning, perhaps, at this time is the resurgence and the rapid increases being observed across the European and Southeast Asian countries. But also that there are areas and regions that are showing promising trends. For example, the continued decline of cases within the Southeast Asian region and relatively low rates observed across the African region. That said, many countries in these regions, and we heard from the previous presenters, are still experiencing challenges. And we should not forget that there is a major risk of resurgence, as many countries are experiencing now. So to spend a bit more time on the information products, we'd like to first share with you the COVID-19 dashboard. This dashboard has been in effect since about March this year. With this dashboard, our goal is to really provide a resource for everyone for the visualization, dissemination, and exploration of the COVID-19 data. Is really to improve the awareness of the evolving situation and share all the data that member states are kindly and generously sharing with WHO. It is really with thanks to member states who all contribute and collect these data. The data is then collated and steps are taken across the 3 levels of the organization to validate the information. And we're continuously making both prospective and retrospective updates to these databases 7 days a week to ensure that they're at the highest level of accuracy at that time. So to date, we've had over 32 million users on the dashboard, making it one of the most visited WHO websites at the States. This achievement is really in part thanks to the generous support received by WHO from the tech industry, in particular a company called Sprinkler, who generously provided the support to bring this concept to the world. We're now entering a new phase for the dashboard in terms of development. This second phase will continue through the next year and has been generously supported and funded by the Republic of Korea Ministry for Health and Welfare. to highlight just a few of the features of the dashboard, and I really invite everyone to jump online and explore and find the tools and resources that you find most useful for tracking the evolving epidemic. The dashboard includes interactive maps to review spatial data of cases, deaths, transmission classification over time. There's a variety of epidemic curves at global, regional, and country level to really track what is going on across the world. There are various data tables and data downloads to review activity in greater detail, and also the capacity to download these data to conduct your own analyses. But last but not least, by clicking on any of the countries and maps, you're able to access country-specific information, both cases and death trends. The dashboard is a robust tool, but there are many ways to visualize these data. One thing that we thought important is that we consider both the case and death data, but also other data sources to truly understand the evolving epidemiological situation. This led us to develop the COVID-19 Explorer application. This can be accessed through the dashboard or by the URL that you see on the screen. This really provides additional tools to explore, to overlay, to export a wide variety of data visualizations and indicators at the global, regional, and country level. The app brings together in one place not only the data provided by member states, but also additional resources collected and published globally. This includes data on testing strategies, on population mobility, as well as various indicators of the level of response implemented by countries. But we're not done yet. We are continuously developing this app, as well as the dashboard overall. We're working constantly to add new features and new data sources. In the near future, we hope to add and publish data visualizations on the public health and social measures implemented by countries, as well as some of the weekly aggregate surveillance data that we have been collecting over the short period. Now, these data include information on not only numbers of infections, but also rates of hospitalization, as well as who's being affected in terms of age, sex distribution, and other important indicators. And we really take this opportunity to not only thank member states for their generous contributions to these resources and these data, but also for your continued participation in these surveillance systems. It really is essential for everyone to have a global understanding of this outbreak. And it's through the generous information shared from member states that we make this possible. Also take this opportunity to welcome feedback, suggestions, and other data sources that you would like to see visualized on the WHO dashboard and these applications, and we'll do our best to incorporate them as quickly as possible. To end, I'd like to also highlight that these are not only information resources. There is other resources in terms of the emergency activity occurring globally. This includes our emergency dashboard. We also publish on a weekly basis an epidemiological update and a health operations update. These are really powerful tools to understand and get a snapshot of what is going on in terms of the epidemic. And finally, again, to thank member states, but to thank all the contributors across the three levels of WHO for collecting these data, and all the developers, all the programmers that make these information tools possible. Thank you, and back to you, Chair. Thank you.
Thank you very much, Brett, for that presentation. Now move to the third and final segment of today's information session on COVID. It is an update by the co-chairs of the ACT-A Facilitation Council. First, I would like, however, to introduce Dr. Bruce Aylward, who will then provide us some brief remarks, who will then introduce the co-chairs of the ACT-A Facilitation Council, Dr. John Arne Rottigan from Norway and Dr. Lindiwe Makarubu from South Africa. Bruce, first you have the floor.
Thank you very much, Chair. Excellencies, ladies and gentlemen, I would suggest in the interest of time, and as our co-chairs of the Facilitation Council have now been introduced twice, that we move straight to the presentation and hear from them, and I'd be happy to answer any questions or help with clarifications after. I would like, however, in advance of them kicking off their presentation, just to recognize and thank our co-chairs of both Norway and South Africa for the extraordinary role they've been playing since the first Facilitation Council, meeting with us, the hub, on a weekly basis, reviewing the work of each of the pillars, and really helping us think through how we can better serve member states and optimize our operations in this crucial phase of the ACT Accelerator as we move from the startup to the scale-up of our operations. So, Chair, perhaps to the presentation, and then we can wrap up with any last comments.
Thank you, Bruce, and please, the presentation. First, Dr. Jolani Rotigan.
I believe Lindy will start.
Oh, my God, apologies. Thank you, Bruce.
So, Lindy, over to
My
you.
apologies, Lindy. Over to you.
And I'll move your slides for you.
Lindy, the floor.
Right. Thank you, Chair, and thank you, Bruce. Maybe just to move straight into the presentation. The Facilitation Council mainly aims to strengthen the political leadership that advocates for equitable and timely access to tools, including diagnostic, therapeutic, vaccine products, and in addition to look at aspects of the health systems necessary for the effective delivery. Overall, these efforts are geared towards mitigating the impact of the pandemic, whether it be loss of life, pressure on health systems, the spillover on other disease outcomes, overall economic impact, and so on. And underpinning this is the huge, very significant issue of funding to achieve the results. So I'll just maybe then, just with those few words, go on to say that what we thought we would do this afternoon is to divide our presentation into two bits. And the first will be, as you can see there, a recap on the work of the council and the council chairs, and then move on to the work of the the outcome of the first council meeting. Then we'll move on, and I think Joanna will move on to discuss very briefly the outline on the advocacy developments as we move to the next council meeting. So if we can have the next slide, please. Right. So if we look at the composition, just a reminder of the composition of the co-chairs. I won't go into, we have it in front of us, so we won't go into details on them. But I think what is interesting to see is that we have about 10 regional groups participating, with each region participating more or less, 10 founding donors, 6 market shapers, non-governmental partners, support, of course, from our distinguished envoys, which is extremely important. We have invitees, and in sum, a really broad group of participants in this group. And I should mention that the co-hosts are WHO and the European Commission, and all these groups have been playing a very significant role and part. And I think when we have an opportunity and more time, we will go into a little more detail in terms of what the different Facilitation Council members and groups have been doing. So we can move on to the next one. Yeah, now if we look at, I think it's quite interesting and significant to reflect back on the first Facilitation Council meeting, which you will recall was on the 10th of September. And I think what came out of that first Facilitation Council meeting was, first, I think one will see that there was very high level support from the UN Secretary General, from the Economic Commission, of course, WHO, and some heads of state. In particular, we had the heads of state of Norway, of South Africa, and Rwanda. And I think that the messages that were coming through from this high-level segment were very instructive, very useful. The ministerial segment, I think, was one where we had a reiteration of very important and key messages. Emphasis on our work, having the urgency of the work that needs to be done, on the solidarity that needs to be achieved, and on inclusivity, transparency, the role of science and evidence, all being a key principles as we move forward with this Act A portfolio. What was also, I think, very useful and giving us direction was the Act A plan and investment case, which I think most of us would have seen. And I think that was very useful in terms of giving us direction and guiding our way forward. Some of the outcomes, I think one key outcome was really the agreement on an outcome statement. The outcome statement basically, when we'll see bits of the statement in the next slide. But I think it was also very important that as we move forward as a facilitation council, that we're very clear about what it is that we want to achieve, how and what actually the role of the co-chairs will be in terms of this, what we mean by this sort of political guidance and support. The other outcome, I think, was basically setting the stage for what will happen at UNGA, at the G20 and other international fora, because of course, as a political, as a group that is pushing the political side, the funding, it's very important for us to interact within and at these different groups so that we can, for advocacy and so on. So I think the outcomes, I think it was a very successful meeting, and the outcomes, I think, speak for themselves, and we have them here. If we can go to the next slide, please. So this is the last piece on this part of the presentation, which we've had to really condense and make quite short. But the outcome statement that I referred to, I think, again, I think these are key principles in terms of how we'll be moving forward as the co-chairs, and that is providing sustained political leadership. The political leadership, the guidance, very important, of course, guided with lots of very strong technical documents that can sort of guide the thinking of the leaders. Secondly, advocating for Act A, the investment case. We have heard and we're going to hear about the funding challenges that we have for the three pillars and cross-cutting pillar. There's a lot of work, work that needs to be done, end-to-end work, and I think all of this needs funding, support, and I think this it was a very important piece of work. And thirdly, I think the honor of the shared commitment to leave no one behind. Equity, the equity principles moving together regardless of the resource and funding capacity of countries is another, and I think a key statement that was shared. So I think this was for us, I think we're very pleased that our heads of state and principals were very pleased with the outcome, and I think that all the partners seem to be very pleased, and what we are looking forward to are the next steps, and I think Johan will pick up on the next steps in terms of how we will move forward from this point. Thank you. Johan, can I hand over to you now?
Dr. Rottingham, just wishing to confirm that you're still with us and would be in a position to present the next few slides. Thank you.
Sorry, I was muted twice, so now I'm back. Thank you, Lindy, and thanks to the chair and thanks to the Director General for allowing us, South Africa and Norway, to present this at the briefing. We want to work as inclusive as possible in our role as co-chairs of the Facilitation Council. All regions are represented in the council in some way through the different groupings, but we are really appreciative of the fact that we can brief all member states in a setting like this. So I will very briefly go through what we've done since the first council meeting. Please, next slide. So we have sort of established ourselves. We have now weekly meetings and many sort of informal conversations with the main actors, with the special envoys of WHO, the hub that is situated at WHO and the European Commission, as well as then meetings with, included in that, with the principals of each pillar, as well as the cross-cutting health systems connector. Next slide. Of course, there's a large task that is in front of us, and Lindy has highlighted the need for political mobilization. So it's a need for political, strategic, financial and resource mobilization for the agenda of Act A. So reaching out to all communities and all decision makers is important. And the pillars, the hub, have done tremendous efforts together with many partners, many countries, in the weeks since the establishments of Act A. So next slide, please. We see this, of course, through the main documents that have already been introduced, the status report and the plan for Act A. These will be updated because, as we know, Act A is about accelerating both the development, the production and the delivery of key technologies. In such a process, there are uncertainties and there are unknowns, and as we progress, we need more data, new data, and we need to reshape in a way some of the plans. So we are working closely with the pillars to make sure that the plans are updated and budgeted in the most realistic manner. But this is an excellent start and has been released 25th of September. In addition, all actors have been working on the investment case. I would like to highlight the work of the hub that has coordinated this. Really important. It illustrates that these investments, they are large from a health and from a development point of view. Altogether, $38 billion are needed. Of them, $15 billion already in 2020. But compared to how much the world economy loses every day due to the pandemic and due to the already recovery measures we need to establish in countries, actually that investment is already paid back in less than 2 days just due to the economic consequences of the pandemic. Next slide, please. Act A has been very visible in the media, and I won't go in detail, but both the different pillars have been profiled. There have been op-eds of high-level policymakers, and we've had calls from different actors supporting the agenda of the Act A. Next slide. At the UN General Assembly, there were several events relevant to Act A. We saw the demonstration of clear political support, both in speeches from heads of states as well as in specific side events. I would like to highlight the side event on the COVAX and the vaccine pillar. It mobilized $1 billion and from countries including UK, Canada, Germany, Japan, and Sweden, which is a really welcomed additional contribution. We also heard the announcement, the preliminary announcement of the $12 billion mobilization through IDA and IBRD at the World Bank. It should be said, it's some of that will be able to contribute to the Act A funding gap, but not all of it. And this is being worked out now currently, and of course it also depends on the decision-making processes going on at the World Bank. We also saw a very strong industry voice with 16 life science companies together with the Gates Foundation announcing clear commitments to expand the equitable access to Act A tools. So now the immediate gap for Act A is $14 billion by the end of 2020. Next slide, please. Then on the timelines, we are approaching now the World Health Summit, which will be we are in the midst in a way of IMF and World Bank annual meetings. There will be a side event on Act A and the need for new technologies, 21st of October. We will then have several opportunities to advance the agenda and advance the discussions on the Act A issues in the coming weeks. The World Health Summit in Germany, the Paris Peace Forum, and the G20 Leaders Summit. We are planning for the next Act A Facilitation Council meeting on the 3rd of November, and the last slide is really just highlighting that meeting. Please, the next slide. One more. And the objectives of that meeting is to align on the immediate priorities for Council members and to facilitate resource mobilizations and decisions by countries, both potentially through commitments made at the Paris Peace Forum as well as the G20 Summit. We will have an overview on that meeting of the very promising progress on the pillars, diagnostics, vaccines and therapeutics, and will update on the financial requirements and the remaining gaps, as well as the updated budgets of pillars. But in addition, we really need to bring the investment case of Act A up on the political agenda. It's really a large common macroeconomic policy issue to make sure that we can invest in the development and delivery of these technologies to curb and control the pandemic. So we really look forward as co-chairs to continue these discussions with members of the Council, as well as, of course, extending this through consultations with all member states. Thank you.
Thank you very much, John Arne Rottigan and Lindy Makobulo and Bruce Elwood for your presentation. With that, that is now the three components of this morning's information session on COVID-19, recalling presentations from the Gambia and Zimbabwe, the epidemiological update and overview of the global COVID-19 dashboard and Explorer app, and as you've just heard, the Act A updates. With that, it's now an opportunity for member states to provide any comments or questions you have for any of the three presentations, and I'd ask Fabio Longquist to act as the moderator for this session. We will take questions or comments, and if you could please indicate to whom your question or comment is to be directed from the three presentations that we've just received. So with that, over to you, Fabio. Thank you.
Thank you very much, Chair, and thank you once again to all of our presenters today. As just mentioned by the Chair, we shall now move into the Q&A component of today's session, and we would kindly ask that those member states wishing to take the floor would just raise their hand in the Zoom platform so that we may go to your questions. It doesn't appear that we have any hands raised at this stage. We might just give it another moment to see whether any hands do go up. Thank you. And it doesn't appear we have any questions today. I shall now hand back to the Chair, given this situation. Thank you.
Thank you very much, Fabio. Thank you again to the presenters today. Again, thank you for your joining the Zoom conference, RD Moeti from AFRO. I also understand that, as per most weeks, we have the honour of His Excellency Dr. Harsh Fazan, the Chair of the Executive Board, with us. So if there are no more, hands, member states wishing to take the floor, then I wish all colleagues, Excellencies, a very good afternoon and evening, and shall see you again on the next time we have this information session. Thank you very much.
कंप्लेंट कर दिया वो लंबा जो था ना बाकी लोगों ने